The following portion of Daytime Tri-Cities is sponsored by HMG.
And Dr. Fowler, thanks so much for taking the time to talk with us this morning. Let's start with that quality care piece. What do you mean when we're talking about quality care? What are some of the things that you should look for?
Yeah, quality care really is, what are the results, the goals of the care that you're receiving, and how accurately are you hitting those goals? So it's really about results. Quality care looks at two parts of the results. One are the things we measure in quality. Your hemoglobin A1C, if you're a diabetic, we know that that is associated with your prognosis, your longer term prognosis. And so we can measure that. That's an outcome that we can measure. Access that you have to your doctor, access you have to the team of doctors, access you have to the drugs that you need. Those are both cost metrics as well as outcome metrics. So quality really talks about both cost and meeting the results that you want. The results that you want are not necessarily made up by a bunch of people in Washington or anywhere else. They're really made up based on the patient and the science that we have available, in addition to the facilities and the services we have available that we've networked or coordinated.
And certainly over the last couple of years, we've seen that decline in people getting the health care that they need because of the pandemic. Now that we're starting to make our way out of the pandemic, what's your advice for someone that may have been putting off some of those important screenings?
We've not just seen them decrease, we've seen them drop off. So, these are risk-benefit analysis. Do you stay home or do you go to your doctor visit? If you're afraid of COVID, or you're afraid that the doctor visit could be worse for your health than it is, good, then obviously it tips the hat to stay home. At that point, you'd want to do telehealth and other things because you can get a lot of good care without necessarily going into those environments. So we've tried to, recognize that. But we're past that now. Not that telehealth isn't still good. It's access and it's still available, and we should keep it. But it's time to go back. We've waited maybe even too long to really tell people, go back, get your preventative visits. There is no world where the visit goes away. Like, we can fine tune and have telehealth for some of the visits, but you need that face-to-face with your provider, and you need to pick a provider that's in these networks of things that you can do to get high quality.
And we saw a statistic just the other day that talked about how fewer Americans are actually getting that important primary care. Why is that so important?
Yeah, so younger Americans are healthy, and so they think of themselves as invulnerable. They're not vulnerable to disease, so to speak. But they are. So our healthcare system has tended to wait till somebody's sick. And that's kind of, the patient gets that too, right? Because you got to go sit and you got to wait in line, and the access issues are all there. So we've really built the system around the idea that we're going to wait for you to be sick. We've started changing that. That's part of the quality piece. So we're moving very quickly towards the idea that, no, what we really want to do is get you in a system that keeps you healthy, so that you don't drop off at the end of it. We want to know a lot about you when you're young. We want to know, are you in the group of people that are going to get atherosclerosis and it's going to progress relatively rapidly, so that at age 50, let's say, you really are in trouble? Can we do things early on to prevent that? And the answer is yes. So there's a lot of things that patients don't necessarily think about if they feel good and they're young and they're healthy. And of course, it may be expensive. We've tried to make preventative care as inexpensive as possible, no copays, that type of thing, because it is very valuable for quality outcomes. So I would say to young people, find your network, just like I said to the group of patients that really need to see their doctor because they have problems already. For the ones of you that are healthy and don't have a problem, or at least you don't think you have a problem, get in, because some of these things can really make a difference in your life if you get involved in a network of providers that are really giving you good advice. A lot of it's education, but a lot of it is recognizing that you're not like everybody else. This idea that medicine is a factory and humans are little identical robots that come in and you replace a part or you change a part, that's just not biologically true. Everybody's a little different. Everybody has their own genetic history. Everybody has the changes they've gone through their life with their disease processes. And it's very important to recognize that and get somebody who's, a doctor leading a very well-coordinated team of people that can sort of expand that expertise and get your preventative care done. You need to do that. You'll have a much better, healthier, nice, fun life.
And you talked a little bit about that network of care and how important that is. What are some of the things that people should consider when they're deciding on that network?
I mean, you want to get somebody who's got your best interest, period. So you want to look around and say, you know, what am I actually doing? What am I connecting myself to? And you want to connect yourself to somebody you can talk to. You know, a doctor that you like, a doctor who's in an environment where they have as much autonomy as possible to do the best things for you, because we have a lot of different systems. And in some systems, doctors have very little control, right? They come in, they can see the patient, but they don't have much to do with what happens, where the patient goes, those things. So the most autonomy possible, do that mostly with independent groups. It's not a plug for HMG. It's just saying they tend to be less conflicted around what happens. We do post our prices online because we recognize part of our job is to bring low-cost, high-quality care to you. So we want to be able to say that we're putting pressure on that. It's part of our duty, not just business duty. It really doesn't have much to do with that. If those services were available in our community at the same price that we can make them available, we probably wouldn't make them available. We'd let somebody else make them available. So I guess my advice is find you a doctor, and I would say a doctor. If you're young and healthy, it's okay. Nurse practitioners are plenty well trained for people that aren't horribly sick. That's what they're trained to do. So that's fine too. A network that has the accessibility and the coordination of care. So you want, is to the degree you can, people that are also able to get you to diagnostic centers on a routine basis for your mammograms, let's say, in patients who need it, or your bone scans or other testing. So coordinated systems of care. The ones that we have locally around here are either wrapped around the hospital or they're wrapped around independent practices for the most part, so, or larger independent practices, yeah.
Well, certainly some important information, Dr. Fowler. Thank you so much for joining us today. If you have other questions, you can always find more information by visiting the website for Holston Medical Group. It is holstonmedicalgroup.com.
The preceding portion of Daytime Tri-Cities was sponsored by HMG.